Hi, my name is Matt. I'm a flight nurse from Southern California. This is for healthjobstarthere.com. I'm supposed to talk about my day-to-day work life. Work at the helicopter, I'm a flight nurse, can vary from day to day. We start off checking out the helicopter, making sure that our bags are stocked with the right supplies, that we have all of our drugs that we're supposed to carry for an entire day's work, because we can get a call right at the beginning of our shift and not come back for 8 hours later. So we need to make sure that we've got all of our supplies for everything. The craziest thing I've ever seen at work, there's been so many different trauma calls that we've gone on, are based as about 20% interfacility transports, which are taking patients basically from one hospital to another, maybe a hospital in a rural area that doesn't really have a lot of services, and pick them up, stabilize them en route, and take them to like a trauma center or basically like a bigger hospital that does have the ability to care for them in the best way. The craziest thing I've so far seen is I was doing an assessment, and when I got to the legs, I noticed that the guy was missing one of his legs, and all of a sudden the EMT opens the back of the ambulance and says, "Hey, what do you want us to do with this?" And it's just holding up this guy's severed leg, which I thought was pretty freaking cool myself. So we just wrapped it up and took it to the hospital, and the guy did fine later on. I mean, he doesn't have a leg, but why I chose nursing is pretty much my whole family's in it. My mom's a nurse, my stepmom's a nurse, my dad was a paramedic, and my current girlfriend's actually in nursing school right now as well. I still remember when I was about 8 years old, my stepmom actually landed the helicopter. She was a flight nurse as well for like 18 years, and it was career day, and she got permission to land the helicopter on our PE field for career day. And I still remember looking up at that helicopter and going, wow, one day I'm going to do that. And 15 years later, here I am doing that as a flight nurse and loving every minute of it. Types of training that I got, after I graduated nursing school, they required me, as far as flight nursing and things like that are concerned, they generally want someone who's gone and worked in an emergency room and a critical care unit for a couple years. So as soon as I graduated nursing school, I went out, got a job in an emergency room, did that for years, did some transport on the side and ground ambulances, worked at trauma centers, kind of just a little bit all over the place. And then when I got hired at the helicopter, they provided me advanced training where I went down to like a cadaver lab in San Diego area and worked on cadavers, practicing different things, since that way we couldn't hurt anybody. They were already, donated medical bodies, and got advanced training there. Now, if you're just trying to start off in nursing and you're not really sure if this is what you're wanting to do, I recommend starting off and just taking like a simple EMT course. The EMT courses that are offered like through ROP or even your local junior college will probably be more than enough. They're short classes, a couple months long. You kind of get your feet wet into deciding if medical is the way that you kind of want to go. And working as an EMT, you'll kind of see the 911 aspect of it and see if that's something you like. But you can also see the in-hospital side and see if that's what you like. Kind of a cheap way, without committing yourself to like a 2-year or a 4-year program, that's able to kind of decide which path is right for you. Once you do that, then you got some idea of a direction to go, and you just go from there. So if there's any further questions, feel free to email them back to us, respond back on the healthjobstarthere.com website, and or on our Facebook, and hope to talk to you later.